Doc, I've recently had my first sitting of the RCT and now what are the instructions that I need to follow? Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about what instructions you need to follow after your first RCT sitting. Let's start. So today's episode is going to be very interesting because I have come across a lot of patients who have undergone RCTs and have had some unexpected turn of events, and that's why I thought it is better to prepare people who are undergoing any sort of RCTs and the first sitting, that is the access opening and the slight biomechanical preparation or the cleaning and shaping of the canals. Now you have to understand that if you have come to us for an RCT related complaint, that means the tooth has undergone so much of pulp damage or nerve damage that the nerve needs to be taken out and we need to clean the root canal and then shape it and then fill it with gutta percha, following which we'll place either a filling or most likely a cap if the tooth is very badly broken down. The steps of the RCT I've already talked about in a different episode. We will under local anesthesia. Under no circumstances usually we use we do RCT without anesthesia. So we give the anesthesia depending upon the location of the tooth and the type of tooth, and we will give either a field block or a nerve block depending upon the case and the severity. And under anesthesia we'll start with the access cavity preparation, which is very much required, and we'll enlarge the orifice to see the pulp chamber and do the access opening at least to the basic level so that the cleaning shaping can be done. After this we will probably, depending upon the case, how severe the case is and what is the symptomology, we'll either give a closed dressing or an open dressing. In an open dressing, we give an open dressing because of the fact that the pus should come out of the the pressure inside the pulp chambers. If it's too much because of the severity of the infection, we need it to drain out. In case it's not happening, we will give a closed dressing. We'll place a cotton pellet and calcium hydroxide and then close it off with a temporary filling. Now the first step of any RCT after anesthesia is removing the tooth out of occlusion. That means we will flatten the surface out so that for the further treatment times the tooth is not contacting the antagonist tooth, so that it does not create any traumatic forces on the tooth. Now after this, we have done everything and all those things, we make sure that we are giving you anti-inflammatory medications, which are known as painkillers commonly and misinterpreted as just painkillers and not anti-inflammatory medications. Now this is something that I'm going to stress upon for all patients. It is not that you need to be all heroic about these things, that if you're having pain then only I'll have it. No, the painkiller is an anti-inflammatory medication. That means the inflammation that is ensued because of the infection has to go down, the pressure has to go down, the severity has to go down, all those things have to happen, and that's why we give you a painkiller as advised as per the the instructions of the doctor. We will give you, or we might give you or not give you, antibiotics depending upon the case, the chronicity of the infection, the severity of the infection, and any systemic modifications that might be because of diseases. Now after this, you are supposed to not bite on that tooth. The tooth is expected to be tender. Now there is a difference between a tooth being painful and a tooth being tender. A tender tooth is a tooth which becomes painful once it comes in contact with the other tooth while chewing. So you're not supposed to ideally for the next few days put pressure on that tooth. So you're supposed to chew from the other side. And on top of that, you're not supposed to take any hard substances, not chew on any kernels or hard nuts. That is very important. Some dentists also advise you not to take too much of fermented carbs like yogurt and all those things. That is up to the discretion of those dentists. You should take more of a proteinaceous diet, hydrate well, rest well. Don't do anything that would stress your jaw out in terms of clenching and all those things, because it can cause problems. And expect a little tenderness. If you are having severe pain, any sort of flare up, any sort of pus drainage, any sort of swelling, any sort of redness and unbearable pain, it is absolutely advised to call up the dental office and take up an appointment so that we can evaluate it. So this is today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location and the common oral health problem that's causing you discomfort. I'll probably reply to you after a couple of days and then we can have a chat. Please be patient. I cannot answer immediately as I might be busy with patients or otherwise. And if you have any queries, doubts, apprehensions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.